My name is Ada Skiles, and I'm the Associate Director of the Chapin Hall Center for Children at the University of Chicago. On behalf of Chapin Hall and the Urban Institute, I'd like to welcome you to the first program in the 2009-2010 series of our Thursday's Child Public Policy Forum. We would like to thank those of you who are here in person with us today, and also our listening audience for taking the time to be with us today. Today's program is entitled Improving Urban Service Systems for Children and Families. I know you will find today's conversation both lively and informative. Moderating our panel of experts on this topic is Matt Stagner, the Executive Director of Chapin Hall. Again, thank you very much for participating in today's program, and most important, for your interest in the well-being of children and youth, their families and communities. I will now turn over the program to Matt, who will introduce our panel of experts.
Thank you, Ada. I'm Matt Stagner, Executive Director of Chapin Hall. I'm pleased to have many of you back. I see a lot of familiar faces from Thursday's Child events from the last few years, and we're very pleased to be launching this year's series here in Chicago. Our topic today is the reform of urban service systems for children. I generated this topic after reading Olivia Golden's new book, Reforming Child Welfare, and thinking about the many cross-systems lessons that she touches on in that book. So we are very pleased to have experts from multiple service systems today to talk about the similarities in this tough job of making urban systems work for youth and children, comparing across systems, as well as thinking about what's unique about each system as one tries to do that. So we'll talk about the challenges of systems reform, what it takes to make progress in systems reform, and what we can learn from one another by thinking about this problem across systems. We have four great panelists today. I want to briefly introduce each of them. Each of them will then speak for about 8 minutes each about their own perspective on this, and then we'll come back to some questions and answers. We've taken some questions from our web audience, and then we'll open it up for questions with those of you who are in the room today. Our first speaker will be Olivia Golden. Olivia is an Institute Fellow at the Urban Institute in Washington, D.C. From 2001 to 2004, she was Director of the Child and Family Services Agency of the District of Columbia, and it's that experience that her new book is about. Prior to that, she held several high-level jobs at the U.S. Department of Health and Human Services. Our second speaker will be Juanona Brewster from the Illinois chapter of the American Academy of Pediatrics. She's the Director of Early Childhood Development Projects and also a fellow at the University of Illinois School of Public Health. Our third speaker will be John Simmons. He's the president of Strategic Learning Initiatives and the author of a book called Breaking Through: Transforming Urban School Districts. And then our final speaker from Chapin Hall is Cheryl Smithgall. Cheryl's a research fellow at Chapin Hall, where she examines educational issues for children in the foster care system, in kinship families, and looks at mental health service utilization. So we've tried to have a panel that can look across as well as within these systems. And with that, I will turn it over to Olivia to start our conversation.
Good morning. It's wonderful to be here with this audience, with Matt, with many old friends in this audience, and I noticed on the web as well. It's wonderful to be talking about themes from my book on reforming child welfare, but particularly to be talking about them in this context, because as I was writing and researching and thinking about the issues, it kept striking me that agencies with a history of failure and trying to serve the country's most vulnerable children and families have a lot in common, both in the diagnosis and what's difficult and in the solutions across different fields. And so I'm thrilled we'll be able to explore that today. To give you a sense of why I wanted to write the book, I want to start with a story from my first months as director of the district's Child and Family Services Agency. It's the summer of 2001, and then Mayor Anthony Williams of the district had just appointed me to bring the agency back from a number of years of court-appointed receivership. It was about 10 o'clock at night. One night in my first months, I was sitting with several of my colleagues on our senior team in the office of one of us, and it really hit us in the pit of our stomachs with just a sense of despair that yet again we were going to have about 20 children spending the night on cots on the first floor of the building. We weren't stupid. Our team of senior staff, we weren't ignorant of the research. We knew that this was a very terrible thing to do, that children who had been traumatized by abuse and neglect and traumatized again by being removed from their families were going to be spending days or even potentially weeks sleeping on cots with no idea what was going to happen to them and surrounded by other terrified children. But at that moment, sitting there late at night, calling foster homes on the phone, dialing for a home that we could find, we didn't see any other solutions. What happened? Well, among the many challenges we had in that first summer, some were pretty quick to fix, but that one actually was not. It took us more than 2 years before we could say for good that no child was going to spend the night in the office building. Why did it take so long? Essentially, the problem was how many layers of problems there were, so that each time we fixed one, we found another. Foster parents might become unable to deal with a child's behavior and get totally frustrated when a social worker didn't return their call and show up at the office building. Social workers might ignore early warning signs because they didn't think the system would respond to them till there was a crisis. The police contributed. They dropped kids off late at night, and on and on. So eventually, we found all the causes and fixed them all, but it took us a long time. So that's why I wanted to write the book. I wanted to see if I could make sense of this kind of multi-layered problem and the multifaceted strategies that fix it. To do that, I needed to do research beyond the district. I went to experts, including Matt, who could tell me about other turnarounds, other situations where child welfare agencies had gone from terrible to much better. I chose 2 to study, Alabama and Utah, and I drew heavily on national data, on national research, and my own experience in the Clinton administration as the federal official overseeing child welfare. To me, one big lesson from the case studies that I looked at and the rest of my research is that there is not a single problem that you can fix and child welfare will be solved. And I believe that's true of the other systems as well. The public, journalists, maybe people in this audience, often have in your heads that there's one thing. If you had more caseworkers or better caseworkers or tougher caseworkers or more money or political will or something, it would be solved. But in fact, failure in these situations is multidimensional, and success requires multifaceted strategies. But another big lesson is that success is possible, and I'm going to save that for the questions here, but in the book I do talk a lot about what it was that changed in those sites, what changed dramatically in terms of the nature of services, and about some of the big accomplishments affecting tens of thousands of children that we've had nationally. So success is possible, but it requires complex strategies. And most of the book is about those strategies, about how success happens and what kinds of multifaceted strategies for reform can work. So I'm going to use my last 3 minutes, a minute each, on 3 of those ideas, and then perhaps have time for the rest of them in the question and answer. The first theme I want to highlight is the role of vision. And that's actually kind of interesting because policy people and researchers in many of these fields tend to think that the way you'd improve a system is you'd make a list of 10 problems and then you'd find 10 evidence-based strategies, one for each problem. But that's not how the leaders in any of these sites went about their reforms. They had an overall picture of where they were going and selected problems based on that. Lots of reasons for that, but one of them is that in a system this complicated with this many stakeholders, you need to be able to tell people where you're going, both to pick your own priorities and to get other people lined up and moving in the same direction. Another question I ask in the book about vision is whether there's just one. Is there a single right answer for all child welfare systems? And the answer I come up with is no. There are themes. The child development research tells us some things about what's good and bad for children, but the visions were very anchored in a particular diagnosis of what are the strengths and the weaknesses of each setting. Second theme is the role of the outside political environment. In failed agencies, it's not all about what's inside. The history of passivity, of blame, of the inability to get going and do something better is anchored in an outside political environment that's failed in some way as well. So all of the leaders had important strategies for seizing a moment of opportunity. There was a moment when something was capable of changing in the outside world and then building on it. Sometimes in these fields we talk as though political will were an off or on switch, but actually it's more of a process. You give an opening and you build more success onto it. This is actually an arena, we can talk about this more after, where there may be some interesting differences between urban and non-urban systems in terms of the complexity, the role of media, the role of multiple jurisdictions that make up a metropolitan area. Third theme is the role of information learning and performance management. In all three sites, the leaders were deeply involved personally in creating and improving information so they could see where they were going and how they were doing. And in issues touching vulnerable children, like child welfare, it's of course very important not to be using numbers that send you in the wrong direction, that lead you, say, to disregard the most vulnerable in order to show measurable improvements. And as a result, in all of the settings, especially in Alabama, there was a real focus first on inventing and then refining qualitative measurements that would give you some rich information about the characteristics of what you were doing. So there's lots more to say on that. So just to close, one of the things that perhaps we can talk about in the Q&A is the question of what does it take to find leaders with the capacity to think and act on strategies across all of those dimensions. And I say in the book that I very much hope that at this moment, when a new administration in Washington is getting people excited about public service, that some of the people excited about public service will not think only about policy and only about Congress or ideas embodied in legislation, but will get excited about the really hard but rewarding and fascinating work of leading and changing large organizations. Thank you.
Great. Thank you, Olivia. Our second speaker then from the health systems perspective is Juanona Brewster.
Thank you, and thank you all for attending this morning. I feel very fortunate to be with this group talking about some of the findings that we've had through the Illinois chapter of the American Academy of Pediatrics, which basically it's one of the larger chapters of the Academy of Pediatrics, and we have been able to do, because of that, certain kinds of research that actually you would think that you and I had a lot of conversations about these issues, because some of what I'm going to say is going to sound like I'm repeating it. But I think the significance is that there's a lot more in common than not when we start talking about issues related to working with children. Pediatricians look at some of these issues from the perspective of coordination of care for all populations of children. Some of the work that I do is specifically focusing on children from birth to age 3, because thanks to research, we have been able to actually pinpoint some things that we have known intuitively for a long time. Things like such as witnessing violence or having somebody in your family who is experiencing violence will affect a very young child. Learning that early intervention, which I often just say EI, so I want to say up front, early intervention, which is a system around the country, but here in Illinois, it is a system that allows for children where they're at risk or where there is suspicion, even on the part of the parents, that something isn't quite right. And they might not be able to name it, but they know it isn't quite right. 0 to 3, these children can go into these systems. We have 25 local child and family connections around the state where people can receive evaluations and services. We talk about opportunistic situations. What drove a lot of the work that we do now, frankly, was lawsuits or the threat of lawsuits, not for pediatricians, but for some of the state agencies that came to us ultimately and said, as pediatricians, the children come to you routinely, most children do, even if they're in the child welfare system, come routinely for well-child visits. They get their immunizations, their weight checks done. And so we want to expand the kinds of things that happen during a well-child visit to include developmental screening, social-emotional screening, screening for autism. And what we know now is the earlier you can start to screen for these things, the sooner you can attend to these issues. Above and beyond that, here in Illinois, there is now a law that requires pediatricians to do screenings of moms for postpartum depression. The reason being that moms, after about 6 weeks, are probably not going to see their own doctor, but some of the serious issues around maternal depression happen later than the 6 weeks after they give birth, but they are taking their children to see pediatricians. In addition to that, we do screening for domestic violence now because we're able to demonstrate, again, something we've known for a while, but really demonstrate that children in the very young years can be very negatively influenced by witnessing domestic violence. We know that adverse childhood experiences really can affect us into adulthood and influence various kinds of illnesses and certainly mental health issues. So in Illinois, the Academy made the decision that they were going to be involved in doing these screenings. After about 3 years of doing all the screenings and referring children into the systems that were available, the pediatricians began to realize that that was almost a Band-Aid that they were putting on a situation because they didn't necessarily either know where to refer children throughout the state or even able to find the resources that were available. So then we start looking at systems and policy changes. And so one of the committees that we have right now is the Policy and Legislative Advisory Committee, really working to look at these systems changes. Very recently, throughout the state of Illinois, we conducted a series of open forums using the World Cafe model. Some of you might be familiar with it. That was its own challenge because some of our pediatricians thought it was too kumbaya-ish. They were used to having something where they could come in, have their say, and that was it. And we were bringing in people from various systems and really trying to bring parents in to really talk about the challenges that they had. What was interesting was, again, there were more similarities, whether it was Southern Illinois, Central Illinois, Northern Illinois, or Chicago, than there were differences. What we learned is that there's a general concern for lack of helpful and appropriate resources. So we knew, and especially when it's related to children's mental health. So we knew that that was something we were going to have to look at. There are many concerns, and this also relates to working with the school system, many concerns about what happens to children in Illinois when they turn 3. If they're fortunate enough to have had some kind of a diagnosis that tells us they need some early intervention services, at the age of 3, they have to go to the local school system. If they were not screened before 3 and they get into that system, often depending on the system, on the school district, there may not be adequate resources for children that are immediately available. So then we have to start looking at how we work through different systems to make those transitions successful, whether they happen through EI or they just happen after the child gets into school. So then you start looking at policies related to how are school systems funded? Why is it that my grandson who lives in Matson, Illinois, can get excellent services, but if he lived 1.5 miles over in Chicago Heights, he might still be on a waiting list for the same services? We really have to take a look at that. Above and beyond that, we discovered that in the various systems, child welfare, social services, the school system, there is very poor communication or lack of communication at all between these systems when a child goes from one system into another. for various reasons, some of which are related to policy and some of which are related to territory, and some of which are related to talking totally different languages, all using English, but one system not at all understanding what the other system is talking about. So last year, we began to look for vehicles to help us figure out, as the Academy, what we can do to impact these systems. Again, this was not something pediatricians are used to doing. They're used to seeing children, and the idea of advocacy is still relatively new for them. So we were able to find, through the Commonwealth Fund, some of you may be very familiar with that organization, the funding to begin to work with the Early Intervention Network and to open up communication between pediatricians who refer and the networks. That's going to be very important when we watch the outcome of that. In addition to that, we have begun to look at what we can do in terms of the transition piece. So I think that in the last minute or so that I have, I think I should also say that, once again, the role, what kind of vision do we have as a community, as a state. This really hooks into the national vision for how we care for children and looking at coordination of care. And that we need to have multiple people at the table. Again, it was a challenge, but it was so helpful for us to have people from various systems at the table talking about their experience.
Great. Thank you, Juanona. Now turning to the education system, John Simmons.
Thank you very much. It's a pleasure to be here this morning. In cooperation with the Chicago Public Schools, I have come with a message of hope for everyone. Hope for our most challenged schools. I start with a story about failed schools in the lowest income neighborhoods of the city, and then discuss the lessons learned and make some recommendations for policy. So the key piece we faced 3 years ago was a group of schools that had been consistently on probation for over 10 years. 9 of the 10 schools were on the superintendent's list, the CEO's list, to be closed or reconstituted. 96% of the students came from low-income families, and 5 of the 10 schools had non-English learners. What the schools did not have was progress. The leadership of the CPS asked us to see if we could help turn around these deeply troubled schools. And if you'll look at what happened over the next 3 years in the chart that you have in front of you, and those people who are coming in from a distance electronically, it's hopefully the handout that you have downloaded. Essentially on the left is a bar chart with 2 bars. The first bar represents the progress that the students were making on their ISAT reading test, the Illinois state test, for the years before they started to work with our model. They had 1.1% increase on the tests per year. That was the average. Over the 3 years, the average increase of those students on the same set of tests was 4.0%. That's a 4 times increase in the rate of learning in those schools. And 6 of the 8 turned around. 2 of the 8 were the most improved schools in the entire district for that year out of 473 schools. And if you look at the next chart, it goes into the specifics of individual schools that were part of that summary. Again, on the far left is a bar that shows what the average increase for those schools was over a 3-year period, and that was 3.4%. The 6 schools to the left made improvements of up to 6 times what they were doing before they started this new approach. So this is a story about radical change. How did that happen? What were the specifics? Did our group replace the school leadership, replace the faculty, force out failing students? By the way, a very common practice in large school districts around the United States. They disappear the students. Or convert to a charter or contract school. Well, we did none of the above of those things. And in fact, we decided that there were some very powerful models out there that we needed to be thinking about and using, and that there were, in fact, 3 powerful drivers of organizational change. Not curriculum change, not training the teachers change, although that's a piece of it, but the organizational change that should be in place. We used a powerful research model for closing the student gap. It comes out of the University of Chicago research at the consortium. It includes support for the principals and teachers on site. It includes assessments every 5 to 7 days of the student's progress. And those records are not kept in a grade book. Those are no-stakes assessments. The children track those. And finally, a key part of the model is working with the parents in the buildings to help the parents better understand the Illinois standards, which their children are getting the week after they're sitting in a workshop learning author's purpose, which is one of the standards, and taking materials home with them to help their kids with. So that essentially is the basic model that helped these school leadership teams turn around their schools. So here are 3 of my learnings from the reform of a terribly ineffective and often a dangerously injurious system that exists in many of these urban school districts. First, my expectations were far too low. I didn't realize that these teachers and principals in these buildings could achieve such dramatic change. Yes, we'd been working with similar schools for 15 years beforehand in Chicago with a similar model, but we'd never seen results quite like that. The second learning was that offering leaders in the schools a choice about how to improve what they were doing and with whom they would like to work made an enormous difference and is a key step to the empowerment and self-respect that is missing in these kinds of systems. These 2 learnings helped us discover a third learning, that among the lowest performing schools in Chicago, ones that had been written off by everybody, there was a large reservoir of teachers, principals, and parent leaders with untapped energy and creativity and motivation for improvement. The fourth learning is that this reservoir can be tapped in 3 years and at a very low cost per school, a radically low cost of 10% of the cost of some of the turnaround models that are being used. So, don't these lessons provide a moving and powerful message of hope for policymakers, providers, and parents? So, we think so. And here are a couple of very specific policy implications. There are 3 criteria that are used in the education reform community for identifying innovations. Is the innovation replicable? Is it scalable? Is it sustainable? The RSS, as it's called. Well, we think this model is replicable because it's been using earlier generations of the model over 10 years, and it's based on very sound research. Is it scalable at the low cost we're talking about? Absolutely. And is it sustainable? Well, we need a few more years of data. We only have 3 in this most recent iteration, but we've been doing this work for over 15 years, and we've been getting continuous improvement along the line. So, in closing, I have 2 basic recommendations for reforming school systems. One is that state and local policymakers assure the funding of cost-effective 0 to 3 early childhood programs for all children. Imagine children coming into school with the kinds of of characteristics that have shown up in the early child research for over 40 years. I visited iScope in the 1970s and saw that stuff happening and was absolutely amazed at what could happen. And the second recommendation is that the lessons of these schools can be replicated in demonstration projects in each state in the country so that educators can easily see the results. We learn by seeing and doing. John Dewey. We forget that as we get into the policy game and think everybody's going to pick this stuff up by reading the books and the articles. Especially in any applied profession, people must see what they are being asked to implement. So those are the basic pieces that I want to mention this morning, and I'd like to just say that we could close the achievement gap and regain our international comparative advantage, providing quality K-12 education if we could put in place these recommendations.
Thank you, John. Our fourth speaker is Cheryl Smithgall of Chapin Hall.
Thank you, Matt. My goal this morning is to make the case for looking at data and looking at it across these systems, building on the idea of leaders having a vision. How do we support that vision with data and with information? Let me start with a finding from some current work being done by colleagues Bob Gerga, Rupa Seshadri, and Peter Ballard. 20% of children in Chicago come from families that have been involved with 2 or more public social service systems, including mental health, substance abuse, child welfare, and juvenile or adult corrections. 20% of children come from families involved with 2 or more of those systems. At the practice level, professionals commonly use release of information forms, family team meetings, other approaches to obtain information from and consult with other professionals. They recognize the need to understand how other aspects of the individual's life or other treatments impact the work that they will do with the client. But we're often lacking a parallel for that at the administrative and policy level. Most administrators have access to their own information systems, yet their view of the population that they serve is often restricted to the time periods that they're involved with those clients and the aspects that they address through their assessments and services. Another way of saying that is we look at which children and families come into and out of systems, and we might benefit from looking at how and when these systems come in and out of the lives of the children and families. Let me ground this in some examples of work we've done in the areas of education and child welfare. The education field is increasingly recognizing the importance of social and emotional experiences and their impact on learning. The child welfare field has shifted its focus to include well-being, one aspect of which is education. Both systems can benefit from a better understanding of the complete developmental and educational trajectories of these children and how experiences in one system impact experiences in the other. That is, what delays or progress or important educational experiences occur before, during, and after a child's time in foster care or involvement with the child welfare system, and how does that relate to children's long-term outcomes? From the other perspective, what maltreatment and foster care experiences occur before, during, and after the child's entry and exit into school, and how does that relate to learning and educational attainment? The sharing of data and information may or may not be accompanied by collaboration, but it can ground the discussion and facilitate each system's effort to evaluate and reform its practices and policies. The data can help define the problem in scope and nature, identify which aspects can be addressed by each system, and allow for a more complete assessment of system change. I think it's equally applicable to program evaluation or the evaluation of specific interventions within these systems. Many families are involved with more than one system. As interventions are put in place and evaluated, we see value in understanding how multiple systems may be working to impact some of the same families, much in the way that individual practitioners seek to understand how other interventions or circumstances impact the work they will do with their clients. I'm going to stop there and turn it back to Matt so we can have some discussion.
Great. Thank you, and thanks to all of the panel. I'm going to take the moderator's prerogative and begin with one of my own questions. Then I have a question from the the web audience, and then we'll open it up to questions within the room. All of our speakers talked about changing systems by also paying attention to what goes on outside of those individual systems. Olivia noted the outside political environment, the moment of opportunity that requires some conditions in other systems outside of child welfare. Juanona talked about the schools, John talked about 0 to 3 and the earlier education systems, and Cheryl talked about information. How, when you're working within a system, do you think about leveraging other systems outside? The negative thing that can happen, I think, is that people in one system point to the other systems and say, if they would only do what they need to do, my job would be much easier. What are some elements of successful work across systems? I'll start with Olivia.
Okay. Let me give 2 or 3 examples or characteristics that I think it takes. The first thing I want to say is that successful leaders in tough, messy urban environments or tough, messy rural environments have a lot of skill at diagnosis. They've had careers that have given them some ability to see outside, or there's a leadership team where some people have moved up but others have a breadth of experience. And so an example of diagnosis, what I mean by that, sort of knowing what goes wrong typically in your setting, is that in the district, there was one particular characteristic way things had failed, which was a little different from Alabama, which was a little different from Utah. In the district, the finger pointing, appearing in the newspaper, everybody rushing to distance themselves from the public agency and everything blowing up was the pattern. So we knew that. So the chief judge and I, at the very beginning, made a commitment to each other to sit down and deal with things directly rather than in the newspapers. Why did we do that when it hadn't been possible before? Well, again, that came from a moment of opportunity when, for various reasons, the chief judge wanted the agency to stay with the district. So we had a moment and we built strategies on it. Second thing I would say is that the collaboration across systems, across service systems, has to be driven by urgent priorities because it takes so much time. If you think about what John told you about what it takes to create change in schools and me about what it takes to create change in child welfare, the idea that you could get them to work together requires that it's so important to both agencies that they're going to put a huge amount of energy into finding ways they can make things better. And I think you can do that, but I think you can only do that on 1 or 2 really important fronts at a time. And I have some suggestions about what those fronts are. I share the babies and toddlers view, but I think that's another characteristic of doing it effectively. You're very targeted. You don't try to just integrate everything and make everybody collaborate.
Juanona, John, do you have comments on this cross-system thing?
I just make one observation that systems learning is really all about looking at different kinds of systems, and we spent a lot of time in the education area looking at the military and at business to understand how to help isolated teachers and principals work smarter and not harder. And the way to do that is to put them in a team and effectively help them learn that 2 heads are better than 1. And once they get that concept through experience, they then naturally will gravitate to using grade level teams, leadership teams. They need support and training for that. This is the way the untapped energy and creativity gets tapped. It's through putting people together in ways that create extraordinary results. So think teams. And the business sector and the military, I was also in the U.S. Army between high school and college, so I had the great benefit of actually being trained in ways that I never at that time understood was possible. So think teamwork.
Great. Juanona?
I think there's a lot to be said for that. I look at my own life experience, professional experience, and my own education, 18 years of corporate sales and marketing, 2 degrees from a well-known seminary, and then law school. And I'm thinking there's not one of those models that talked about teamwork, except for the sense of this is the team and here are the policymakers and the decision makers. That isn't really teamwork. That is not mutuality of relationship. And that's a tough thing to do. Most of the training that most of us have had says that somebody has to be in charge. It's often not the family. Family is just not considered significant except in finger pointing quite often. And so we have to look at that. We have to look at, basically what that means is looking at a willingness to collaborate and not be territorial, whatever that system is. And not just assume that because we've got the education and maybe even more experience in the system that we really know all the answers. I think we have to have a common goal. And so when we look at what we're all talking about, the reality is we're talking about helping children to develop into good citizens. If you think about it, it's that basic. We do it through making sure they have health care, education, that hopefully they don't end up in the child welfare system, but if they do, all the efforts point towards helping them to be good citizens. And by that I mean developing healthy relationships, being able to hold their own in society. That's the reason that a lot of decisions are made about when children are not doing well, when they need to be in systems, that they're not following those models. So I think that willingness has to be there. I also think that we have to do a lot of educating of policymakers who tend to think in their own training area, which I think is human, that's what we know, but really conversations about what the medical model means, what the legal model means, what goes on in child welfare. And that requires communicating with people at a place that they will understand. So.
Great. Cheryl, did you want to add there?
I think we also need to recognize that case examples, anecdotal examples, and personal experiences can be very strong, and that sometimes when that blaming is occurring, that's where that's coming from. That was certainly the case when we, began the education and foster care work. There were very strong opinions that some schools had half of their children in foster care, and that was really the problem. And so, that teamwork, that collaboration is important, but grounding that discussion in some data is helpful as well.
Can I build on that?
Sure.
Just want to say that one of the things that was very striking in the 3 sites and has been striking nationally in child welfare is that when you can ground your experience both in quantitative and qualitative data, so that the power of an experience where you talk to a child and you talk to their parents and you talk to the foster parents, you can get that power in a way that's not random by having people do structured qualitative reviews. And those were invented in Alabama, which is one of the sites. They've been adopted by the federal government, and the other locations that I studied, as well as many other states, have tried to figure out how to do that more in a way that works for them. And many places do, for example, bringing in a case and trying to get everybody to think about it and experience it. And it's for the reason that Cheryl gives, that data really matter, that you need more than numbers to capture the power of the experience, and that if you can do that in a structured way, it's a really powerful way of learning.
Great. Let me turn to, I'm going to blend together 2 questions that came in over the web. One was about the role of evidence-based programs in system reforms. The other is about prevention to help before problems develop within these systems. So if I could put those 2 together and ask if anyone on the panel would like to talk about, I think we often feel if we just had an evidence-based program, we can plunk that into a system and things will be good. If we have all evidence-based programs, then we're even better. But I think this panel suggests there are some systemic issues where that can either help us think about evidence-based or possibly could make it that an evidence-based program that worked in one area may not work in another. So does anyone want to take that one on?
I mean, I'd be happy to, but I'm sure others will want to build. I guess I would say 2 things. The first thing I would say is that I think much more valuable than any single evidence-based program is the weight of research evidence, both evaluations and clinical information that tells you things like what children need. Because when I had kids sleeping in the building overnight, in some ways I didn't know what question to ask to which an evidence-based program would have been the answer. It's like if I recruited foster parents, there were evidence-based programs for that, but that didn't fix it. So it wasn't a program, it was a knowledge from an array of programs. And once you get to a better place where you're better defined, then you may well be able to pick a program, a family team meeting strategy, once you know in a more defined way what your question is. So I think it's the weight of evidence that helps you early, and then you can go to specific programs. The second thing I would say is that I do have a chapter in the book on where I think the weight of the evidence is about prevention programs. And I shared John's view that big investments, I know we have our regional leadership on the Early Head Start program here, that big investments in infants and toddlers in the most disadvantaged families I think are very important. I also think investments in maternal depression and parental mental health in general and substance abuse services could be very important intensive preventive interventions. I think if health reform passes and parents actually have access to services, that could be a very big investment in preventing entrance into child welfare.
I would agree with that. Part of the reason that pediatricians have become so involved in focusing on domestic violence and maternal depression, and we are really beginning to open up and feel more comfortable with the idea of really trying to do some red flag understanding of child abuse and neglect too. You'd think pediatricians do all that stuff, but no, they don't, for various reasons. But it has been the evidence-based and accumulation of evidence about what influences children that has enabled us to look at these systems and to bring forward information to policy makers about why, if we invest in 0 to 3 education, health, mental health, it will be an advantage, if nothing else, in terms of savings down the road. I think sometimes we have to realize that while we may be motivated by doing the best for children and families, there is that very practical economic consideration. And so evidence helps us to talk about ways to not necessarily get more money, but to use the resources that we have to focus in a particular way. That becomes very important. Yep.
Cheryl and then John.
I think we also need to, I think there's an increasing recognition of the need to understand how the program works and with whom. So it may be evidence-based, but really getting in there and understanding how and with whom, because not only is that important for sort of replicability in another area or a different region, but these systems have changing populations too. Mm-hmm. You know, over time, who they're serving may change. And so even if you have an evidence-based program that works in a particular system at a point in time, you need to understand how that may need to be adapted or continually revisited.
John.
So I'd like to ask about what the evidence is looking at in terms of the process for introducing the change. Is it a process that respects the stakeholders who are about to be changed? Are they empowered to take a hold of the process and make it their own? Is it flexible? Is it based on key principles rather than mandates from the central office? Were there people from the grassroots engaged in designing the process and the program? Those are the key issues in terms of building the ownership into these systems for the change. In school systems, teachers look at the new superintendent and say, we'll see. And they decide. In 6 months, they've decided if they're going to shut their doors and continue to do what they've been doing, or whether or not they're going to get out there and participate in these new grade level teams. It's all in the way the leadership approaches the leadership of change that determines whether these things that we're talking about are successful.
Great. I'd like to open it up to those of you here in the room with us in Chicago. So if you have a question, raise your hand. When you will be approached by a person with a microphone, I believe. So raise your hand high so that the microphone can come to you. Then say your name and your organization you're with, if you're with an organization, and address the panel.
Hi, hello. Hi. I'm Susie Breitenstein from Rush University, and I just have a question to piggyback on the prevention. In what systems do you see service delivery for prevention efforts? Does that make sense?
I mean, let me see if I'm answering the question as you meant to ask it. I mean, the United States doesn't have a very developed set of services for prevention, and interestingly, one of the studies I cite in my book by someone named Jane Waldfogel argues that one of the reasons we have much higher neglect reports than Canada and Great Britain is probably, it's either that we have higher poverty or that we have much less access to services outside. We don't have much in the way of universal systems. So then you have to think about what would be potential locations for prevention. And people offer different answers to that. My answers are to focus particularly on building early childhood. Once kids get to school, many people think of schools as a good location. Pediatricians and the healthcare system, I think the challenge right now is that we have very little access for kids' parents. We have good access through Medicaid and CHIP for low-income kids, but really crummy access for parents. If health reform passes, we'll be in better shape with that. So right now, I think the choice about what systems to build and to invest is partly a choice of opportunistically where do we think we can get it, and partly it's thinking about what has the right orientation towards parents and families and could be successful.
John?
I just make a very short point. When we go into buildings, we survey the parents in terms of what their needs are around, and they come up with 9 times out of 10, we want to know how to help our children with their homework. So that is a way to look at how to deal with prevention. The prevention of children dropping out, of getting alienated from their parents as well as the schools, it starts in that kind of interface with the parents in this example. So, and we repeat that survey every year in the same building, and guess who runs the survey? The parents in the school through a committee we put together. So the data are trustworthy, valid, and they even help people who can't read or write fill out the questionnaires. Imagine how that builds the trust we need to get this kind of prevention. It's absolutely key. You can't start at high school trying to prevent high school dropouts.
Great.
If I could just add, there are other of my colleagues who could speak to this probably better than I, but I'd be remiss if I didn't point out that we really need to examine how we finance these systems as we look at prevention, because I think that that ties into where we allocate our resources and what we can do.
Great. Let's go here.
Krista.
Bring your 2 microphones if you have to.
Good morning. My name is Krista Thomas, and I'm a child welfare specialist with the Children's Bureau at the Administration for Children and Families here at the region in Chicago. And I think that we've heard a lot about the improvements this child welfare system has made in looking at the field holistically. And we've heard a lot about the great strides that have come due to the intersections with health, mental health, education, and a lot of the other collaborations that we've heard about this morning. One partner that I feel like we don't talk enough about, and I'm going to include the federal community, and that is our partners in housing. And that's an area that I'm wondering, since so many of the child welfare families and potential relative placements are either homeless or housing insecure, I'm wondering, with your experiences both in research and in your practice, if there have been some strong collaborations, but either at the state level or local levels with housing departments, and any improvements that have come out of those.
That's a great point. And as we thought about the systems to put on this panel, the housing system and the difficulties of transforming that system were one of the ones that we thought about. But I think I have to start again with Olivia, because
Okay.
that clearly was an issue she dealt with in the
I'm going to
district.
first of all do a commercial announcement for my colleagues at the Urban Institute. Jennifer McComber and one of her partners in our housing area have just gotten an award from the MacArthur Foundation here in Chicago to do research about the new issuance of housing vouchers that are going to be available to families in the child welfare system for reunification, and they're going to be doing some research on the implications of that, so we'll know more. I think what I would say about partnerships with housing goes back to the comment that you just heard about funding, because in general, all of those issues of how do you make big systems fit together are far harder when the systems are really underfunded, and so it's very hard for them to have shared priorities. So housing, both public housing and housing voucher issuance, this question of why should we give priority to poor families who've abused their kids when we have huge waiting lists of families that haven't, is a very challenging issue for, in a country that's not in general investing in low-income families. One of the big mission issues that comes up in collaborations with child welfare is why pick this priority. And so there have been efforts to overcome that, but I think that it remains difficult, and it remains difficult. The partnerships you need are often about, as you say, prevention, which might be hard even to figure out who you go to. They're about reunification, that is, a mom probably isn't living in a big enough place to take her children back there. And they're also often very big issues for foster families and kin foster caregivers who, particularly in urban areas where having an apartment with enough bedrooms to take a large group of siblings is really difficult. So I think that one is a struggle for reasons related to resources as well as mission.
I would just like to add, it is really intriguing to me. Most of us know that little Maslow triangle thing. You know, actually, I take it more seriously than triangle thing. But what we know is that safe shelter is one of the things that has to happen before families can pay attention to some of the other things that happen to themselves as families and children, the children in the families. And so it is always striking to me that pediatricians may look, as an example, since that's those with whom I work right now, may either look at or assume that housing is not an issue that they need to attend to unless a child comes in with lead poisoning, as an example. We make a lot of assumptions that children who are not necessarily in the system don't have housing as an issue. We already know that you don't have to be in the system to be in school, in the child welfare system, to be in school and have poor housing. We know that some of the neighborhoods where we work, we don't have to assume that these children are in the system to know that they're still coming from homes where the housing is not safe. And that's part of the reason I think it's important to take a look at this issue, not as a separate issue, but part of the mix of what we need to attend to. So.
Question in the back there.
Good morning. My name is Esther Chamarela. I'm the director of the Chicago Hispanic Health Coalition. I think I want to reinforce the idea that the collaboration is an issue. I think in many, us as a provider, we don't know who's doing what, how we collaborate with each other, and the fragmentation of funding in communities are hurting. And I think that is something they need to be, has been addressed on leadership, how we change communities, because even it's not city, our community who are totally different. So how we reinforce and work more together, and from the federal perspective, we have funding supporting and continuous helping people who are doing well in the community. So that's a comment.
Thank you. Would anyone on the panel like to comment on the role of community involvement? John, perhaps, in how you think about the communities surrounding these schools? And
well, it's absolutely central. School people are not trained to deal with it, and unless they have the community engaged, they're missing a huge driver for improving results in the classroom. Chicago is blessed with a law that forces parents and community members into each of the 630 schools through the local school council law of 1986. So it's the parents and the community members through election every 2 years that chooses the principals I'll bet there are people in the room who don't know that. And they also then approve the budgets for the poverty money that comes into each of those schools. Dramatic results in the test scores started 2 years after those councils started to function. And 10 years after that law was passed, St. Paul, Minnesota's Board of Directors came here and chose that model, implemented, and doubled their test scores in 4 years, just by including the community in decision making. Think of that. Nothing to do with curriculum, new books, community involvement as part of the organizational design. Fascinating, isn't it?
Good. We have a question over here.
Good morning. My name is Janet Merritt, and I'm from Chicago Public Schools Department of Homeless Education Program. I was very interested in what you had to say about having parents to get involved and having to build their trust. One of the things that I do in my department is we have 27 homeless shelters that we service. And we go into those shelters and we build after-school tutoring programs for the children that live in the shelters. I manage 2 of them, and what I've noticed is the missing link is the relationship between the mom and her understanding of what the child is going through developmentally and academically. So what I did for the first time yesterday evening is I went into the shelters and I said, each week I'd like to have a meeting with the parents, and I would like to talk about child development and how they develop academically as well, to teach the parent so that the parent can get involved. What will your ideas and your plans for change, how will it speak to those parents, and what can we do to get those parents who are in homeless shelters, or any parent, to become more aware of the experiences that their child is having in order that they can support those experiences?
I will just share with you that the Academy of Pediatrics did a research project, I think 3 years ago now. It was intriguing. They did surveys of parents generally in their understanding of child development, because there are implications for how you discipline a child, that kind of thing. And they found that people with a college education had about a 27% accuracy rate on questions. It was a small number of questions they had to respond to with an understanding. Now, I mentioned the education piece because I think there's an assumption that people who are in various systems have lower educations, and that's why they don't get it. It's across the board. So what we have realized that we need to do, certainly in the pediatrician's office, is that anticipatory guidance piece about what to expect. But above and beyond that, as the Academy, we've made a decision that we're going to reach out to early childhood educators, early childhood caregivers, and really, they may, in their own education, know about these things, but not necessarily know how to communicate the information to the families. And so do some training with them so that they have that kind of information. And that becomes very helpful. And I was particularly glad to note this because before I came to the Academy, I was working in juvenile court with the CASA program with children who are in that system because of abuse and neglect, and even some children on the other side of the building. I say that because here in Cook County, that's the way it's laid out. And one of the things that we learned is that many of the families who had children in the system because of abuse and or neglect were there in part because they did not understand that a child developmentally at 2 is not lying when they say certain things and does not, the appropriate response is not some kind of punishment. So this becomes something that's very important across the board. And so that's one of the things we're trying to do. We're early in that process, but we are hoping that that's a connection. There's one other piece I would like to add. We hear about parents not necessarily being involved in education and not credited for their knowledge a lot in the child welfare system. The number one complaints that parents have about their pediatrician, pediatricians are like nice people generally if you look at their profile, low divorce rate, low substance abuse rate, they just want to help the kids. The parents don't believe that they're listened to. What we have learned is that when parents are listened to, if the parent goes to the pediatrician and says, I think there's something wrong, she doesn't talk like all of her little friends. Traditionally, the pediatricians would say, oh, give her time. Parents are accurate. When it comes to suspecting autism, parents are so accurate, it's really scary. And like 87 to 89% of the parents understand that there's something wrong with their child and it may be autism, way before the pediatricians are willing to look at it. So the other thing that we're working on is really encouraging pediatricians to listen to the parents and the parents' concern, not with the idea that they have to just comfort the parents, but there's something they need to do. So.
Great. Olivia?
I wanted to make just a couple points, because first of all, you hit on something that's incredibly important and really hard for many service providers to come to grips with, which is it's not just about meeting the parent's needs, it's about enabling the parent to interact with the child in a way that works for the child, and then having the child's needs front and center. So it's about a two-generational approach. And what you see in a lot of the systems is that when people have good intentions, say in child welfare or in a home visit program, they might say, children don't come on their own, they have parents, we need to respond to parents. But then they might get caught up in meeting that parent's immediate economic needs. But that actually is often not enough when a family is in a difficult situation. It's not enough to fix the roof or pay the utility bill. There's also something about how the mother needs to interact with the child. So that's the first thing. The second thing, which may be a little bit of a disagreement with Juanona, I'm not sure, is that, is that okay? Yeah. For many families where things are pretty bad, information isn't enough. It isn't just that the parent needs to have information conveyed to them. It's about her often, or his emotional capacity to be there for the child. And that might be about something like a parent's history of abuse or substance abuse or depression, and in those cases you're going to need some extra services. Or it might be about a totally horrible, stressful situation which is using up all their energy, right? They're homeless, they have no energy left for the child. And so it'll be more than information in many of the difficult cases. The third thing, and this is, to borrow John's word, a story of hope, the early Head Start evaluation about infant-toddler programs, one of my favorite findings is that at the beginning, they had an effect on the parenting practices of depressed moms, but no effect on their depression at the beginning. After the 5-year evaluation, they found an effect on depression, and the researchers studying that think that part of that is about a positive cycle. When your child is doing better and is easier to parent, that may in turn cycle back to your own ability to be a good parent. So one of the things I think you hope for in all of these programs is that if you can keep them going long enough, your two-generational strategy ends up becoming a positive cycle instead of a negative one. Instead of, my life is miserable, my kid is screaming, there's nothing working, it becomes, things are getting a little better for me, they're getting a little better for my child, and that makes me able to be an even better mother. So that's what your goal is, I think.
I think we also need to recognize the multiple demands that different systems put on parents, and really take a look at whether our policies are supporting parents' ability to be engaged in the ways that we know are important for them to do so. You know, a lot of low-income families have jobs and employment and supports that aren't very flexible in terms of allowing them to show up at school at different times or be engaged in education, and we really need to examine how that all fits together across the system.
Good. Question here.
Good morning. My name is Randall Strickland, and I work with the MacArthur Foundation Models for Change Initiative, which is a juvenile justice reform initiative. And my question really is about this problem of siloing of work and decision-making and policy-making. Prior to this, I worked for nearly 10 years at Cook County Juvenile Court, the Probation and Court Services Department. And when I started there, I asked if part of our training would include exposure to the public guardian's work, state's attorneys, public defenders, and people looked at me as if I was crazy. And so I think in addition to this being a problem, a legislative problem, a policy and leadership problem, I think it's also a workforce development problem. And I think that we would begin to see much more positive change from collaboration when training in university settings for those child-serving professionals, when that collaboration is prioritized. And I'm wondering if you think that that is an important issue, and if there are programs in schools who are doing that, who are really training child-serving professionals to think across systems, across silos in collaborative ways?
That's a great question, and I think we should ask sort of each system to touch that. So let's just go down this way. Cheryl, do you want to start?
I'll just sort of add to that I think that a lot of policies around information sharing make that very complex for the professionals, and particularly if they're new to a system or a profession. There's, FERPA guiding education information, there's HIPAA guiding health information. Sometimes you're at the intersection of both of those, but I do think that in that training we need to help the professionals navigate how that information sharing can be done that's balancing the privacy of the families and individuals that we're working with, but allowing the sharing of information and idea exchange that will facilitate the collaboration that we've been talking about this morning.
Good. John, you touched on this in your remarks. Do you want to build on the workforce issue?
Just very, very briefly, information sharing and training, we all know, does make a difference, but it has to be part of a larger model, a systemic model that gets into the nature of the organization and how those values of respect and listening are reinforced on a daily basis. The local school council model in Chicago hammers that right home. Those parents are there in those buildings. Those teachers who are on the council are there every day. They're providing the accountability that policymakers have been demanding for decades. And there's a system right there inside the organization. So a lot of it is just about organizational design. Is there a way to reinforce the kinds of messages you want to be sending to the people? These values, are they being reinforced? Respect, trust. That's what, when you really peel off the layers of the onion and you want to predict behavior in organizations, go in and measure the trust levels. 23-item questionnaire that the consortium gives out every 2 years to all the teachers in Chicago. And guess what it shows? Buildings that have high trust get high student results. Schools that have low trust, trust among the stakeholders, the parents, the teachers, and the principals, don't do very well. You can almost, in fact, in the private sector, you can predict 18 months in advance, given a trust data questionnaire, whether the productivity of the plant's going to improve or fall. Now, what does that tell us about structuring stuff in? Like a survey.
How about health professionals?
Absolutely. Well, when we look at working through various systems, that piece about understanding the reality of what HIPAA is, as an example, needs a particular kind of education. I've been intrigued over the years listening to various systems tell me why they can't share information because of HIPAA. And when I went to law school, we studied it. It hasn't changed that much, but it's really intriguing. So that kind of education. I would also add something we found to be very important and really has happened as a result of trying to do referrals to other systems on the part of the pediatricians, not just the pediatricians, but others. And that is making sure that those to whom we refer, children and families, have the appropriate education to be offering this, to be doing the services that they are offering. And so we now know, I think Erickson Institute is a good example of an organization that is really focusing on training people specifically in child development issues and early childhood mental health issues. I think they're offering either a certification or degree program as a response to some of these concerns. And there are many examples. It wasn't that long ago that anybody could be a mediator if they said they were. And that's the way it would happen. It didn't mean they possessed the skills or had accountability with another group. And mediation services are very important in so much of what we're talking about. So we have many examples of that really are workforce development issues and have to be looked at in a way that's very different from the way we used to look at why people made decisions about particular education and training.
Olivia.
I would agree with your overall point that exposure during professional training and education to a range of systems is really important. And people writing about leadership in the private and public sectors have emphasized that while having a deeply knowledgeable professional grounding in one thing is important and is increasingly a characteristic of modern life. It's not enough. You have to have the experience of crossing lines. So I agree with that. But I guess, again, I'm not sure if I'm disagreeing with John or just adding to it. I think you also have to go far beyond the individual or even characteristics like trust of a particular organization in thinking about what collaborations are going to be sustainable in a particular place. And the reason for that is that there's some very important reasons not to collaborate. The values and missions of our public agencies, particularly as set by the Congress and state legislatures, have limits on them. We're not, the mental health system isn't supposed to be providing on the taxpayers' dollars mental health to everybody. They're supposed to be focusing in many places on the most severely and chronically mentally ill. And that's one of the forces that when child welfare agencies are trying to connect to them, child welfare social workers will also often see it as about silos or turf. They won't look at our kids. But in fact, at some level, it's about a conscious choice to have that organization have that vision. So if you want to fix it, in my view, you have to pick areas where you want to shift those visions enough that the two organizations can connect, and you have to find some successes, because people won't sit there forever just to have a relationship. They'll sit there to see that there's something they can accomplish. Just one short example, which is actually a failure example of mine from the district. We worked hard with the district school system because there were a million areas where we knew we weren't doing right by each other. Special education for kids in foster care, lots of complicated interjurisdictional issues. Kids might move from the district to one of the suburban systems when they went to live with relatives. We didn't do that well. We never succeeded, and the fault was on both sides. We were both troubled systems trying to do a good job. We had to focus on our own priorities, and we never managed to make our shared work a priority in those first few years. And I'm not sure that I would do something differently now, except I'd say, well, maybe in the 4th year or the 5th year we could get to it. So I think you have to pick the areas where you can carve out a common vision, see results, and have something measurable happen, and then you can get there.
Good. I'm going to turn back to the webcast questions for a minute. A question came in about the use of data and sharing it with the public and the role of transparency in making systems better. I know that's something that Olivia talks about in the book. John has shared some data, so who would like to take that on first?
Well, how can we have trust unless there's transparency? And what's more important than trust in designing, in driving high-performance organizations? Absolutely essential. So it's the leadership. Does the leadership understand that they need the trust? That they have to have it structured into the organization by asking people to get engaged in problem solving and decision making? It all comes down to empowerment when you really peel off the layers of the onion. And does the leadership understand that and carry through with it? And it's all around the data. So data is a huge driver of raising awareness among leaders who are asleep at the helm.
I mean, in child welfare, there's this interesting dynamic that if you're not sharing data regularly, then what people know about you is when a child dies or when there's some other tragedy. So creating the ability to generate data that has credibility and to share it and to get people to believe it matters, that it's not just a PR release, actually is in the long run very helpful. The question is, how do you get from here to there? And in the 3 sites, I actually think that Leisha Welch, who is one of the attorneys from my Utah site example, may be on the web. I saw her signed up. And Utah has exited court supervision, and a very central part of their exit plan was that they've dramatically improved their data collection, which all the locations did. But they went, I think, the furthest of any of them in engaging outside parties, not only in sharing data, but in gathering it, in being partners in the qualitative assessments, as well as sharing the information. And when you can get there, what you have that's very powerful for reform is you have the ability to have people kind of know what you're trying to get to stick with you for a while. One of the big problems public agencies have is that the expectations change every 6 months, right? We wanted you to do this, now we want you to do this, and we're about to hold a hearing on why you didn't do X when what we told you to do was Y. So if you can get people bought in to a set of measurements that stay the same over 3 or 5 or 10 years, or even some of them stay the same, that's very powerful. It isn't easy to do, but it's really important.
Great. Maybe time for one more question over here.
Hi, I'm LaShonda Pittman. I'm at Northwestern University in the Department of Sociology. And I've spent the last few years studying grandmothers raising grandchildren on Chicago's South Side. And I'm wondering about, as we're talking about improving all of these kind of macro level systems, to the extent that we're leaving out the meso level, which are the ones that kind of are the first line of defense for a lot of families in crisis. So local level social service agencies, faith-based organizations, these are places that families turn to in crisis. And to the extent that we're not shoring them up, what they're ending up doing, I'm finding, is relying much more on the child welfare system in places where something else could be taking place. So I'm wondering about kind of, they're missing from the conversation around improving
That's a
urban
great
systems.
point. And you're raising the question of, are they part of the system, or are they them or us, or somewhere in between? And I think both John and Olivia, maybe Juanona, have something to say about that.
Want me to start?
Sure.
I mean, you've raised several levels. You've raised extended family as a support for kids, and then nonprofit, faith-based community organizations. Extended family is actually one of the areas where the child welfare system has made big improvements in terms of the policy structure for supporting them over the past 10 years. Huge. First, the creation of subsidized guardianship as a potential policy strategy, which had a lot, was based in part on work done in Illinois, and then very large increases in the number of children who have that, and in the overall funding, and now federal funding for it. So I think that's an example where what was happening on the ground ended up influencing the policy structure. But of course, that's not enough. Money is really important, but it isn't, definitely not enough. And what I would say about informal, faith-based, and community organizations, I guess I'd say a couple things. The first is, we're talking about urban systems here, and I think there is some evidence that that's one of the differences between urban and rural child welfare, where urban actually has an advantage. We tend to think about cities as having the toughest times, but there is often a lot richer capacity for service delivery, though not always in the places where families are most distressed. Sometimes the geography doesn't fit. Second thing I would say is that, to me, the challenge is combining the informal and the formal. And I think there is a risk in child welfare, at least, that people will lean too hard on the informal because of the gaps in the formal, and will ask the neighbor, the minister, the local organization to be a substitute for, you know, the high quality clinical treatment for depression, when actually you want them together. You want the informal and the formal. And I think that's a big challenge that we have to figure out how to achieve.
Well, in terms of, I absolutely agree with you in the work that we've done in trying to incorporate extended families on a variety of levels, because they offer the support, and frankly, they're often an excellent resource. I know when I was in working in juvenile court, extended families were often dismissed because the idea was, if they raised these children who abused their children, then what value do they have in this whole process of continuing to raise a child? And I think some of that is changing. I would like to speak to the faith community piece. I have 2 graduate degrees from Garrett Seminary at Northwestern, and I was always intrigued by how dismissive certain systems are of the value of faith communities in influencing how families can find their way through difficult problems, knowing in particular that the kind of training certainly that you get at a place like Northwest, that at Garrett, is very much about, it's hardly ever about, can you preach a good sermon? It's mostly about, how do you work with families and guide them in a way where they can do the best for themselves and their children. And I think some of the dismissiveness is because there's often a lack of understanding about the strength of relationships between families and their faith communities, and how much they rely on them truly, generally. And I think we're missing an opportunity, if we don't spend more time working with faith communities, to influence families in a positive way. So,
John, you've talked about the community and parent involvement. What role in your reform schools were the extended families playing? How do we think about
Well,
that?
they were there because often one or two of the parents weren't there. So they were included in absolutely everything. And the best principals knew that, were on the streets greeting the extended families. It's a wonderful thing to see these high-performance schools working in the city. And it's all around just this kind of thing, how they reach out.
Cheryl and
I think I would build a little bit on what Olivia said in terms of understanding that as a continuum and how the informal and formal fit together. I think we need to recognize the dynamic nature of some problems and situations and circumstances, and we need to reach out and help some of those who are working in the informal systems understand when something might rise to the level where it is appropriate to engage a formal system. And similarly, in the other direction, those informal systems might really benefit from understanding and having communication flow from those who, in your words, were sort of more in the first line of defense. They are seeing what's happening perhaps before it gets to a point of requiring formal system involvement.
Great. I'm afraid we're near the end of our session here. I want to give a few words of thanks, first of all, to our colleagues at the Urban Institute who helped us with Thursday's Child. This is a co-production of Chapin Hall and the Urban Institute, and our next session will be in Washington, D.C. in January. So those of you who can't travel to it, I hope will look at possibly participating via the web, and we want to thank those in the room today for attending, as well as those on the web. And I want to thank the communication staff of Chapin Hall for making this event happen. From, as they say on Car Talk, our shameless marketing division, I would like to note that Olivia will be around afterwards. There will be copies of her book, Reforming Child Welfare, and she would love to talk with you further. All of our panelists, I hope, can stay around for a few minutes and answer questions. These types of sessions, I think, can be frustrating sometimes because in 80 minutes we don't solve the problems that many of us have worked on our entire career, but I hope that you go away with some refreshed understanding of some of these issues, some new ideas, and some new energy, and I appreciate you coming. Thank you very much.